But we also know that this is just one of a broader conversation we want to have this morning. And we're talking about how we're having this, but also the number of cases we're having. And Professor Alfred Yawson, an infectious disease expert and a public health expert as well, is joining us. And good morning to you. You're streaming with us. Good morning to you, sir.
Good morning.
Great.
How are you?
Yeah, great. I'm okay. And I know that the Wassey has become important because the students need to move on. And you will say this has been well received by the medical community?
Generally, yes. Once we got the children into school in the first place, there was no reason to send them back home, because that was going to create a much bigger problem. So once they've gotten into school and we know where they are in relatively more confined areas, then all we needed to do was to improve our targeting and tracing. Wherever a case is detected, you move in, you do all the right things, and still keep the children in school. So now that they are in school, all must be done to ensure the safety of the children, the safety of the teachers, and then give assurance to the parents that the children are being well taken care of. And then we can hopefully see them through their exam, which is, for us, the crucial point. Once they get through the exam, then measures can be taken put in place to then send them back home safely.
The rate at which we're recording the cases, just at a briefing by the Minister of Information on Sunday afternoon, we're told that, look, it looks like, not that we're out of the woods, but we're getting to see some improvements. As a medical person and somebody who is also in the field of practice, what would you say to some of these information that we tend to get?
Yes, there are multiple things we need to consider. And generally what I believe the National Health Service was putting across was that the cumulative figures, that is, all the persons we've tested positive match, those numbers will certainly continue to increase. However, it is the rate of increase as well as the number of recovery. So if we are going on a trajectory where we are having increasing recovery, the numbers of new infections may be going up. If our recovery exceeds the new infections, then with time, you will see that gradually, that in all sincerity may be the ones that will effectively transmit the virus from one person to the other. And therefore, if we continue to all the then you with that, as we move on, let's say you are 28,000 and your recoveries are 27,000, which means effectively the active cases are only 1,000. That is, for example, if we do not continue on the trajectory and we relax and do things otherwise, bring people together in masses and do things that will increase the rate of new infections, then the number of active infections will continue to increase, and it's from among those that unfortunately some may perish. But for those who are mainly asymptomatic, to have a large number of those, that is good. What we need to continue to observe and to do is to reduce the number of new infections being recorded.
Now, just 148 fatalities. Well, you can say we have confirmed cases and we're having 27,000 up to date and all that, but it looks like we've been able to manage the fatalities by the ratio of the infection that we're having. How were we able to do that?
Yes, generally, that is one of the fortunate aspects of the pandemic, I would say. Our fatality rates have relatively been lower. multiple factors could account for this, and we will also say that the way we handle the epidemic right from the beginning, active surveillance, enhanced surveillance. So in that time, we got those who were infected, who otherwise would have spread it rapidly in the communities. We try to confine this to the minimum. So it is generally the approach we took as a nation in terms of surveillance, contact tracing, enhanced surveillance, and getting all those who had come into contact with others quickly into isolation, quickly into treatment. Once you bring people into treatment early, then you are able to manage the complications. And here we must pay a lot of tribute to our health workers who are in the front line, who are doing everything, sometimes under very difficult conditions, to save the life of our folk. And we must commend them. They've done quite a great job, and they continue to do. This has been going on for several, now going forward. The apathy, tiredness, demotivation, these are all factors that can creep in. But so far, the health workers, all those biomedical scientists doing testing and all that, they have really worked hard. And as a nation, we should be grateful for it. And I think it's all contributing to what picture we are seeing now.
For public health purposes, if you compare us to, let's say, some of the developed countries, and then even the countries that have had reinfections, because maybe there was a restriction period, either a lockdown or some loose restrictions, and then the easing of such restrictions, how would be what would be your observation? And how do you think we need to follow a pattern based on what we've already done to keep this on track?
Yes. The countries learn from experiences of the other. And as some places were in the epidemic, so others had the opportunity to learn from what happened. We are Africa generally, and we in Ghana. So we have and therefore, we were able to put in measures, closing our borders quite early. And then the numbers that had already entered were not very high at that time relative to others. But in other areas, this was not so. They had so many more community spread, and the risk was relatively high, and therefore they could record what numbers they were recording. We, as I said, were fortunate. We have learned from some of the things, and then the national response relatively was quick, was swift, and that's what has brought us thus far. But we shouldn't, going forward, think that things are okay. It's not okay. We are nowhere near being okay. All the measures is rather more important now to be strict, and therefore the number of active cases will continue to reduce.
On the continent, we've been touted to be one of the first 5 countries. Of course, South Africa is always at the top. That they are recording high numbers because they are doing more testing, and we also have followed through, and we've been praised for it. How should we continue with this?
Yes, the testing is important, it's critical. We need to continue to test. It is only through testing that we see the real picture. Therefore, the fact that you test more, you get more, it's important, but it's not adequate. We still need to continue to test. And all the challenges, we should, as we go on, try as much as possible to reduce the turnaround time for receiving results. Measures in place. So as for testing, we need to continue to test as we are doing. We need to put in measures to decentralize the testing as much as possible so that all areas of the country will have capacity to test. It's going to be centralize everything. We need to build regions. We manage on their own through testing, actively following cases, and then making sure those who recover are discharged and get back into the community.
Right. You mentioned the delays in the result, and all of us tend to experience it. I was just having a conversation with my colleague, Mamavi Osabwaja, about how all of us have gone through the public regime of testing, and when you know that the results are delaying, it also means that you are not in this alone. Now, how is that, based on your experience, problematic for the overall projections, whether recent or for the immediate future?
Yes, one of our stronger points, as you mentioned, as a nation, has been our ability to test relatively many more people than other countries. But that in itself is fraught with some challenges. Right from the beginning of the pandemic, there were challenges, they were delayed. At a point, we were able to clear the backlog. And we must say and congratulate the workers in this area. They bend their backs to work so hard. But sometimes the numbers are overwhelming and challenging, as we said, because we didn't have a lot of avenues for testing. Private sector came in, they've done so well. So we encourage some of these partnerships to happen. It may not necessarily be only at the public places. If private partners can come on board, do testing, get results for people as quickly as possible, and also the challenges with reagents, with commodities that are needed for the testing, if they are available, and then the facilities will be able to do more testing, and that's reduce the turnaround time. So there are a number of factors, commodities, and then limit the number of places that the test. We have tried to overcome some of these challenges, but others still persist. And as we move on, we should look in this direction. More testing areas, availability of reagent, commodities, and all that needed to do the testing. And also partnerships, private partners and others can come in and support.
Well, thank you very much, Professor Alfred Yawson, a public health expert and infectious disease expert as well, and teaches with the medical school, and so helps us continuously with some of the bigger conversations on the subject. And that's where we have to take a break. Again, we did tell you, we'll have Senor Wassey, who is leading that private sector fund and convening and making sure that we have now a foremost infectious disease center. And Mamavi Osabwaja had been doing a lot of work since the beginning of its construction. The commissioning is this Friday. We'll have Senor Wassey on stream and talk to us about how they've been able to come far with this and what we intend to achieve, just broadening this whole initiative beyond Greater Accra. Stay with us. We'll be right back.